Okay, good afternoon, everybody. The last session of a long day. And I would like first to thank Uri for giving us the opportunity to put this session together. And I think it's an important one, especially within the framework of the day that has tried to touch upon different aspects of educating or teaching clinical neuroscience in general. And I think what I would like to say is a few introductory words. And to start with the traditional research that has been discussed all morning, which is the classical unidirectional translational research pipeline. With the basic science, the proof of concept studies, which is the type 1 translational research, then the clinical trials, and the health service research and delivery, which is the type 2 translational research. This is the typical way neuroscience and science is working, and what we have heard all morning is mainly looking at this part of the road. And I would suggest that neuroscience is like an elephant. It depends where you look at it. It can be the rope, it can be a wall, it can be fun. And I think we cannot look at the traditional way that we have been used to look at elephants or at neuroscience. And just as an example, a simple example, is let's take neuroplasticity. This is based on a paper that was published a few years ago in Brain, where when we look at neuroplasticity, we can look at the level of the cell, the circuits, the molecules. We can also look at the level of the assessment or the clinical phenotypes, trauma, stroke, mental and addictive disorders, pediatric and developmental disorders, and as well as in the interventions or assessments. All are heavily linked, and we have to, in order to study neuroplasticity in its full spectrum, we must include not only the cellular level or even the circuits, but the clinical aspects are very important, and the communication between those two arms, as well as the interventional outcomes, should be discussed. So the newer model for translational research is the bidirectional. It is going from basic science to the three different levels, proof of concept, clinical, and health service, but also from the health service, the needs of the patients, the community, into clinical trials, proof of concepts, proof of principle, and basic science. And all are heavily governed by the organizational crystals, like stroke network, joint funding, commitment and research cultures, as well as the biological catalysts that are pushing the research in the different directions. And I think the idea behind the modern clinical neuroscience is to implement this concept into the university and to educate our students to look at the problem in its whole spectrum, from the molecular level to the community and clinical questions. So what does it include, the clinical neuroscience? Normal development and the aging aspects of the nervous system, understanding the natural history, the diagnosis and treatment of diseases affecting the human nervous system, understanding disease impact on the patients, the family, and the society, translational research in relation to the nervous system, understanding the principle of clinical research involving human subjects, and the ethic aspects that all are part of this whole clinical neuroscience world. I'll just highlight the aim to develop a university-based curriculum, exposing Tau students to the clinical aspects of neuroscience, increase the involvement of clinicians and patients, and maybe even families in the translational research at Tau, develop a continuous dialogue between clinicians and basic scientists, and increase the collaboration between hospitals and community-based research and the university. I think this is a very ambitious aim. We have heard this morning that the hospitals are quite standing alone type of partner in this world of neuroscience. There's a lot of research done there, and not very much appreciated, I would say, at the level of the university. So the milestone is agreeing about its importance and mapping the forces and partners already involved in clinical neuroscience at Tau, identifying the gap between the needs and the present situation, and develop the clinical neuroscience community, which I think will be the base for better communication and future development of more interactive partner in neuroscience in Tau. And from that opening words, I would like to show that this is the program. Professor Achiron will start, and then Professor Gozes. Dr. Shai Konas will discuss the psychiatry aspects, and if time will still be there, I will have some closing remarks. After each speaker, we'll have some time for a discussion, and I'm looking forward to a lively discussion. Anat, please.